Good afternoon, everybody. This is our mic check. If you can hear us and see us, go ahead and give us a thumbs up so that we'll know everything is working properly. And we will start promptly at 3 o'clock.
Good afternoon. Hope everyone's having a nice day. It's really pretty outside. And I'm going to go into my report here. I'm going to go through that before I actually give the numbers today. Start off with for those of you that saw the governor's report yesterday, or those of you that didn't get to see it, he did extend the emergency, his actual proclamation. It actually, make sure the dates on this because we had two changes. He extended the public health emergency until May the 13th. Okay, now that's different than the actual shelter at home or stay at home order. The shelter at home order, he did extend it on into April the 30th, which is the end of this month, and so that's something he did after he actually they actually voted to give him the authority back as far as the health emergency. Okay, so remember those two dates, and especially the 30th, because that is that's what we're living under right now, and so just bear with that. This thing's far from being over, so just try to keep doing what we're doing. He also shut down all short-term rentals until April the 30th. That's all Airbnbs and VRBOS. This includes hotels, and this excludes hotels and campgrounds. So they are still considered essential. They can still stay open. The let's see. Also, he activated 3,000 troops for the National Guard. That kind of alarmed some people. We had a few calls on that, kind of didn't really go into details to really explain what that was all about. But what that is, he already had 1,000 that he'd already activated, but they are assisting our nursing homes, hospitals, as far as the sanitation, cleaning, going in and helping those people. Had a report from Lamar Lowry just an hour or so ago, and Lamar says that they are over there at the hospital now. He works for the old Tri-County. It's Memorial in Georgia now, of Georgia. So they are over there cleaning, going through and sanitizing all the nursing home facilities and also in the hospital. So not to be alarmed about that. That's his purpose for that. And then, throughout Georgia, that they're probably have spread pretty thin. 3,000, as many hospitals and facilities as we have. He decided, on the state parks, we've actually had submitted, as many commissioners had submitted a plea for him to close the state parks. Well, from what he explained yesterday, he's got in place his plan as far as limiting the cars on all the state parks going in and out. He wants to monitor that maybe for a week, he says, but he assured us if it's not working and his crowd control is not working, he will close the parks. So we'll just kind of play it by ear and see exactly what happens on that. And I do know that they were not as busy this weekend as I reported out there on Saturday and Sunday, but there was still approximately 80 to 90 cars, and so that still is a lot of people was in and out. So we'll see what happens on that. I want to remind everyone that our offices will be closed for Good Friday tomorrow. We'll still have our 3 o'clock report, but as far as anything tags or anything like that, all state offices and federal offices are closed on Good Friday. Now our transfer station, and I keep mentioning that, it will be open. Had a meeting this morning. Sheriff Cross, myself, Alex, and our major was in there, and it was a pretty lengthy meeting. It was a conference meeting, and really they've got a good plan. They've really got they put a lot of thought in this. They're going to bring the boys back. They're hoping to bring them back in May sometime. Whether it's the first part or the last part, that's what they're working on right now. And of course, everyone's got to see just where this thing's at when they do decide to make sure the governor has lifted some of these things, because he could even extend after April the 30th if it's really getting worse. He could actually extend, and the president could come out with more stipulations too. So that right there will be a big factor in it. But we'll keep you updated on that. And the importance of that is, some people don't know where the lineman school or know where that's. Most people do, but it's about 250 young men and women that come into the county from all over the country, from everywhere, and sometimes even overseas. But so that's really an important. It's important for our economy, but what we're looking at now is actually the importance of the safety of these people and where they come from. They've got a really good plan right now as far as quarantining the boys 14 days before they actually come into the school and all that. So they've got put a lot of thought in it, and like I said, we'll keep you up on it because we're here to protect the safety of all our Dade County people. Go into my report here. This thing is far from being over. I want to tell you that I feel good that we're doing everything we can, and some of these things are still the same. We had some counties go up. We are still the same. We don't have any confirmed cases as of today, but as the federal government and even the state is looking at it, this week and next week is going to be they call it the Pearl Harbor Day or whatever of this whole thing, and because things are kind of out there. It seems like the people that have had reported cases. The people that actually have been quarantined, a lot of them now, in the next few days will be either positive or negative, and they're looking at a lot more positive cases. So, we'll just hope and pray that don't happen. But we're doing everything we can, as far as, and I appreciate people and proud of people doing it. But don't get to feeling really good. Alex kind of stressed this the other day. Don't let your guard down, because This thing is far from being over. Like I said, we have 2 confirmed in Dade, and we're the same as we were yesterday. Walker went up 1, so they are back to 4. The Catoosa County, they had 2 more confirmed. That puts them at 9. Chattooga County, they went up 1. That's 5. Whitfield County, for some reason, I don't know why, but they're down 1. They went down to 20. They were at 21 yesterday, and I don't know whether that's I don't know how that happens. But Floyd County, they went from 93 to 99. Gordon County stayed the same. Bartow County went up to 196 from 192. And Carey, we were talking about this. There's actually 1,020 unknown cases in unknown counties, and this could be anywhere. And what that is, we just talking about it. I mean, that could be the homeless people. It could be a lot of things. But there's actually 1,020 unknown confirmed cases out there. So they could be in any county. And as they identify these people and identify, their actually true residency, it could be somebody in Atlanta that's sick, but they live here in Dade County, or it could be in Washington D.C., or it could be, that's something right there. There's been a total of 369 deaths. That's up from 362 yesterday. Tennessee, Hamilton County, they went up from 94 to 97. Marion County stayed the same. Grundy County stayed the same. Squatchy County is the same. They have 1 in Squatchy County. Meigs, they're still they're up 2. They actually had 1. Now they're up to 3. Bradley County, they went from 25 to 28. Jackson County, Alabama, they were at 18 yesterday, and they went up to 22 from just in 24 hours. DeKalb County, they're holding their own. They're still the same. They're 14. There's been 70 deaths in the state of Alabama. That's up from 65 yesterday. So as I said, this thing is far from over. So just try to keep doing what you're doing and listen to the governor. I know it's hard. It's hard on a lot of people, and it's hard on a lot of our businesses and a lot of people that work. But just try to stay on path with what we're doing right now. Have several people here that today we have Josh from Dade County Schools, Josh Ingle. Have Tammy Franklin. She's going to give her report, and also we have the sheriff here today. And so, Josh, if you want to come up, and we'll go ahead and let you go over your report. And appreciate all of y'all being here.
Good afternoon. I had a chance to speak with Martha Baker earlier today, and over the spring break, they provided approximately 1,100 meals or snacks on Wednesday. And I know that Martha, along with her allies, they worked long hours on Tuesday to get a good game plan together for Wednesday's handouts. So on behalf of Dr. Harris and Dade County Schools, I want to extend our appreciation to Martha for organizing a 2-day event with such a short notice, and to all of our local churches and other faith groups, civic organizations, local businesses, our local community agencies, and any other contributors to help fill this need in Dade County. As far as the school meal distribution, we'll return to schedule on Monday. The buses will deliver meals just as they were doing prior to spring break. And the drive-through will also be available from 10 a.m. to 1 p.m. at Dade and Davis Elementary. For the bus deliveries, be sure and provide a container or a towel or a lawn chair or some other item and the number of meals needed at each stop. We want to maintain a healthy social distance for your safety and for the safety of our employees. And at the drive-through, there's no need for you to get out of your car. If you'll just make sure your car door is unlocked or pop the trunk, and we'll make sure that the meals are placed into your car. If you have any questions, please don't hesitate to reach out to us. I'm not sure if anyone from the school system will be here tomorrow, But I'm sure Carey, if she hasn't already, will provide my contact information as long as Dr. Harris's information, and we will get back to you just as soon as possible. So thank you very much.
Hi there, I'm Tammy Franklin from the Health Department. Just a couple of things I wanted to talk about. As our numbers go up, we have the 2 cases, we'll probably have more. So wanted to remind you, we will not share names. Our local health department does not know the names of the cases. They're actually reported to the state epidemiologist who reported them to our district, and that's in Rome. So they're the only ones that know names. When I call and ask questions, sometimes they might give me numbers. Most of the time, they're just like, this is nothing that's shared. So just remember, none of us here know names. So I guess don't call and ask. It's not important to know the names, because with this, we have to just assume that everybody has it, because, they're finding that some people are going to have it and never show symptoms. And some people are going to have it, and when you're around them, maybe they're not showing symptoms yet, but 2 or 3 days later they are. So to know who's positive would give you like a false sense of security. So we really don't want to do that. We want to just assume that everybody around you is positive and assume that you're positive too. So that's why we're going to continue to do, our social distancing. And, we're going to, wear the mask if you're out. You're going to wash your hands often or sanitize your hands often. You're going to keep your hands away from your face. And the social distancing, I don't know if y'all have seen this chart. I have given it to Carey, and I think she's going to post it. She said she thought she posted it once before, but I like to see numbers. When I'm told to do something, I want to know why I need to do it. This is the vital importance of social distancing. It's how a reduction in social contact can reduce the spread of the virus. So you'll be able to see this on the page in a little bit, but I'm going to just kind of explain it. We quantify a contagious disease with a figure called an R0 figure, which means it's how many people one sick person can actually infect. And with the coronavirus, this COVID-19, they are giving it a number of a 2 to 2.5, which means when you look at this chart, based on this, with no changes in our behavior, if we just went on our daily, did everything we were doing before we had to start sheltering at home, a person that is positive could infect, in 5 days, could infect 2.5 people. And in 30 days, that person could infect 406 people. That's with doing nothing. So if we decrease our contact, our social contacts by 50%, this one infected person in 5 days could only infect 1.25 people. And in 30 days, 15 people. And then if the contact is decreased by 75%, that one infected person could only infect in 5 days 0.625 people, and in 30 days 2.5 people. So there's a huge difference, and that's just going down 75%, cutting out 75% of our contacts. So we go from a possible 406 people infected to 2.5. So that's why this is so important. I know it wasn't fun to hear the governor yesterday say, okay, we got to do this till the end of April, because it gets boring. It's just a totally different way of life for us. But just remember, there's a huge difference in the numbers and then the outcome of this. So once again, stay home and please stay safe. Thank you.
Good afternoon. I'm Sheriff Ray Cross. Tammy, thank you for that information. That's very helpful. As Ted mentioned a while ago, I have a note here that no vacation rentals are to be scheduled today after midnight. So, like I say, that does not include hotels and bed and breakfasts, but it does include any vacation rentals that you have. So those after midnight tonight will not be allowed. Some of our safety precautions. I had a call today about yard sales and swap meets that are going on here in Dade County. You know, the governor put this shelter in place, and that does not really cover that as far as being able to do that. You're not really supposed to do that. This is just essential things that you need to do, like getting groceries and prescriptions, stuff like that. So you're not really supposed to be doing these things. And that is what I understand going on here in the city. So I'm sure the city officers will probably be addressing that. It was just brought to my attention about an hour ago. So please, and these are a lot of people coming from other states. I think Alabama and Tennessee are coming over to some of these swap meets, but I don't think that's going to be allowed through the governor's order. We had, I think, 2 arrests yesterday that occurred. Is that correct, Major? 2 arrests here in the county, and they were charged with the order along with the other charges. So, like I say, when you get arrested, you are going to be charged with the order from the governor. And don't forget, once you get entered in our jail, you're going to be quarantined for 14 days. So keep that in mind if you break the law. So that's what we're doing. I want to say a big shout out to, of course, all the staff here, Ted and Alex and Carey and everybody that's working for us so hard in the county. And most of all, I want to thank our medical personnel, EMS, first responders, our fire personnel, and also don't forget our dispatchers. What a great job they do, and our law enforcement officers, and that includes the city and the state and everybody else. But thank you, keep up the good work, and let's get this under control and get back to our normal lives as soon as possible. Thank you.
Thank you, Sheriff. Good afternoon. I'm Alex Case, Director of Dade County Emergency Services and Mayor of City of Trenton. And Sheriff, we'll check on that and see what that was about, that swap meet. And I don't think, again, that qualifies. And again, we've mentioned this all the last few weeks here, is that we're still in a turn-up of this event projection in our state and in our county, that we cannot let our guard up. I know a few days ago I said we're almost in our down stretch of this time, but now we've got till the 30th of this month. So again, it's all of us doing this. We're doing it here every day. We're cleaning every day. That was one of the things we worked on really hard today, with some help from Catoosa County Fire Department, our friends and brothers and sisters in emergency services. We've got some disinfectant material that we're using, older SCBA air packs, and actually down drift paint guns with a very low mist of this disinfectant that we can do. We're doing our ambulances, we're going to do our patrol cars. We just put the one over to Sheriff's Office and for the jail to use. We bought the disinfectant, and it's something that we're doing to make extra measures safe, because we're told to treat every call like it could be there. As Tammy mentioned, these folks could have these signs and we still could be dealing with them. So we're taking the extra precaution besides our normal cleaning up and beyond that's doing that. So it's taking a lot of time. I mentioned as we turn an ambulance around after a regular call, we clean them, but we're cleaning even more now. Then we're going to be spraying this disinfectant in it. We actually tested it on an ambulance a little while ago. So I think another fire department found out this use with their SCBAs. We purchased the equipment today. Businesses helped us out, understood what we were doing, picked up the disinfectant. So we're really excited about that. It's something we'll start using on all of our emergency equipment and even some of our buildings. But again, please keep working hard. It takes us all to do this. We've got to continue to stop this curve. We're still on the up round on this, so please help us out. Again, if you have any questions, all of our information on the website, the social distancing that Tammy talked about, that percent rate, we talked about that a couple of weeks ago. This is what's important of it right now. So of our folks now, of our other person that was numbered through us that has been infected, we are still waiting on information from epidemiology, infectious control from the state. We've requested that information up to see if any of our first responders was involved with us in emergency services. But I'm going to reiterate that we treat every call as that as well now. That's the PPE, the shields, the goggles, If we get temperatures, we put the gowns on. Any coughing or sneezing or wheezing, all of our folks are taking that precaution. And we are working really hard to continue that. So as soon as we know as the government, as soon as the state finishes their investigation and through that, we talked with Tammy about that yesterday. The state district epidemiology will turn that information. Again, it's just the way we have to work through it right now. We want to know as much as y'all just for the safety, but our thoughts and prayers are with that person and their family. They're following the CDC rules and recommendations and isolate and hoping everything's best for them. Again, if you have any questions, please give us a call.
Thank you, Alex. As Alex said, and I mentioned a while ago, we're far from being over with this thing, and so just try to follow the directions as far as your cleanliness and staying, the 6 foot, people, in groups of 10. I know you get tired of hearing that, but it seems to be working. So we'll update you again tomorrow at 3 o'clock. And Carey, what were we talking about a while ago? You wanted to go over, I think it was on some of the, yeah. I want her to come up and talk to you a little bit about the actually recovery, because we've been getting a lot of calls of people wanting to know why that we're not reporting on, how many people's getting well. Well, I'll let her explain that to you, because we've really been spending some time on that.
So several of you have asked about recovery numbers and why we're not reporting on those, why we're not telling you about those, and here's why we don't. After consulting with experts from the Department of Health and Emory and the CDC, it's very clear that there are limitations that make it next to impossible to report those raw totals on the number of Georgia patients who have recovered from COVID-19. In Georgia, we don't have a system already in place to track recoveries, and like when you get the flu, and when you get better from that, you don't pick up the phone and call your doctor and say, "Hey, doc, I'm better, I'm recovered." So we don't have a way to really track that. Lots of people may get this virus without being hospitalized, and their recovery will likely not be officially documented. So also, we have medical privacy laws like HIPAA that can prevent individual hospitals or medical groups from releasing that information to the public right now. So we would also need the state to require this kind of reporting and medical facilities to start collecting it. So remember that we're all feeling our way through this. This is the first time something of this magnitude has happened in the United States. So all of these organizations really are doing the best they can with what they have. Organizations that do report recovery information at this time, like Johns Hopkins University, are using very advanced models to estimate recoveries, and right now the state of Georgia is not using that model. But talking about recovery numbers from Johns Hopkins, they did report that yesterday over 300,000 people are believed to have recovered from COVID-19. You can check out their website. We have shared the link to their website on our website. But we will be watching for those recovery rates, and if people start getting those out there, if the CDC starts reporting that, if the departments of public health start reporting those recovery numbers, we will let you know what they are, because we would like to see those numbers as well. So thank you guys for watching. I do want to do a couple of more reminders. I want to remind you that the census, can you guys see that? Can they see that, Tori? The census has been extended through August the 14th. So if you have not yet filled out your census, please go online and fill that out. As of right now, I think Dade County is somewhere around a 30% mark for the census. So make sure that you're counted. And then for those of you who joined late, Commissioner Rumley did talk about the election, and it has been postponed until June the 9th. So make sure that you are registered. You've got some extra time. Go ahead and check that out. We'll post these on our site. You want to wrap it up?
Yeah. Don't really have a lot to add, except, all of you out there know that, you always got someone to call and talk to. I know it's getting, call it cabin fever or whatever. I know a lot of you that have been really following this. I mean, a lot of people have really been staying in, and we appreciate that. But always remember, my number is 667-8999, area code 423. It's easy to find. It's on our website. All the other commissioners, those numbers there. and we're here 24/7, for you. So if you have any questions, well, that's another thing. If you do have any questions and you want to ask him, I said this the last 3 or 4 days, but be thinking, just write them down. Anything pertaining to this today or even 3 weeks ago, just ask us. You can email Carey, or if you'll call me, I'll be glad to talk to you one-on-one and answer any of your questions. And if I don't have the answer, I'll get it for you. So we'll be back tomorrow at 3 o'clock. And just appreciate everyone watching this, and just try to stay safe. Thank you.